Dr Salma Hanif is one of only 2 GPs in the small town of Boggabri in northwestern New South Wales. Despite its isolation, the pandemic has been a big concern for this community of less than 1,000 people.
When COVID first hit, my patients were worried what would happen if it would reach such a small community. Patients were worried about someone not coming out from the city and driving through and possibly transmitting the disease to them.
So far, Boggabri has managed to avoid any COVID outbreak. Dr Hanif's patients are now lining up to get the AstraZeneca vaccine.
It's great to actually do this locally. We've got to have the support for medical in the bush, and having access to this is fantastic. Okay.
Despite her crucial role in COVID testing and vaccination, Dr Hanif is yet to receive her own jab. A month ago, she was in Sydney, 6 hours drive away, hoping to get the Pfizer vaccine at a major hospital, only to be turned away because she says they told her she didn't live locally.
I did provide evidence of all the reasons why I was a 1A walker. I had written confirmation with that, but they did not accept that.
And how did that make you feel at the time?
Upset, let down.
It is appalling, to say the least. They should have been up front. They've been doing the COVID testing and now they're doing the vaccination. I think it's absolutely appalling.
Dr Hanif says she's aware of other regional GPs facing similar frustrations.
We're still waiting, and yes, I and my other friends would love to be vaccinated.
7:30 sought a response from the New South Wales Health Department. It said walk-in appointments are not available. But 7:30 understands Dr Hanif will now be vaccinated next month. People who are disabled and living in residential care have also been left waiting in the rollout.
My brother's Brian Ross. He has an acquired brain injury. He resides in a 24-hour high care needs facility at Young Care at Wooloowin here in Brisbane.
Natasha Sharp says her brother needs multiple medications and can end up in hospital for the simplest of illnesses.
For Brian's health, the COVID is a scary disease. I actually don't know if my brother would survive COVID. Just because you have a disability doesn't mean you should be down the bottom of the line waiting for a vaccine.
Less than 5% of people living in residential disability care have received a vaccination, despite being among the most vulnerable in the community.
Is it good enough that less than 1,000 people with disability in residential disability care are vaccinated at this point? Is that good enough?
Yes, because it's part of the scheduled rollout.
No, we've got to step up the performance there. There's no doubt about that, and I'm working with our health officials to achieve that.
The whole vaccination rollout has been a train wreck. What we're seeing is a high priority group, people with disability, have been more or less totally ignored. To have fewer than 5% vaccinated when they were in the top priority group is a disgrace.
According to the latest figures, more than 3 million vaccine doses have been administered across the nation. More than 2 million by the federal government, the rest by the states. Victoria has administered more than 300,000 doses of vaccine, followed by New South Wales, Queensland and Western Australia. 7:30 sought a breakdown of the totals by age and type of vaccine administered, but none was forthcoming from the Federal Health Department, nor were there details of how many vaccines have been wasted. Western Australia did provide figures showing that almost 40% of people aged over 70 not in aged care have had at least one shot. However, the number of people aged over 70 with full coverage, 2 doses of either vaccine, is 2.8%.
We've really got to know much more about what is actually happening with the vaccines and the vaccinations. So we ought to know weekly how many doses CSL will produce, how many doses are coming into the country, Pfizer doses by the plane load and so on. So we know this is how many doses are here, this is how many have gone into people's arms.
I think it's going very well. The only criticism I have is that we don't get enough vaccines.
Brisbane GP Dr Ian Williams has seen his vaccine stocks from federal government suppliers increase from 80 to 200 doses a week, but he still has to contend with erratic deliveries.
Some weeks we get it on a Tuesday, some on a Thursday, some on a Friday, some on a Saturday afternoon and some not at all.
The doses that are being delivered by principally the Commonwealth Government through the GPs. That's really starting to pick up pace and we welcome that.
While Dr Williams is hoping for the best, other doctors are concerned that vaccination rates remain low as winter draws closer.
We're always vulnerable to a third wave and serious outbreak, especially while we've got so few people vaccinated. We've got pretty good at dealing with these intermittent incursions, largely through hotel quarantine. However, the wrong strain in a certain community, undetected transmission, we've seen how quickly that can all take off.
Does he have any cough, sore throat, fever?
ما عندك لا سعلي ولا عم تسعل ولا عم تعطس ولا سخوني. No, he doesn't.
Many GPs are spending their time allaying patient concerns about rare blood clotting linked to the AstraZeneca vaccine. Dr Jamal Reefi serves a large culturally diverse community in the Sydney suburb of Belmore. But vaccine hesitancy or refusal remains a significant problem for Dr Reefi's government-funded clinic.
I still have a percentage of patients that I see on a daily basis, knowing that the only thing I can offer them is the AstraZeneca. They still refuse at the end of the consultation to have the AstraZeneca, unfortunately.
Thousands of new doses of the Pfizer vaccine are now arriving in the country. Dr Reefi and other GPs want to deliver the Pfizer vaccine as well, without the specialist refrigeration equipment that's required, which they say can be achieved with improved logistics.
General practitioners, they should be able to obtain the Pfizer vaccine to also help by immunizing as many people as we can in the shortest possible time.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.